AT&T is a global telecommunications leader, and our mission is to connect people everywhere they live and work and do it better than anyone else. AT&T Mobility is one of the subsidiaries of AT&T. You may have known us as Singular Wireless in the past. When a shopper comes into one of our retail stores to be able to learn everything they need to make a 2-year marriage to AT&T in the wireless space, there are a lot of questions that need to be answered. And those questions are different for every customer that comes in to one of our stores. So we needed to find a way to be able to put the entire product catalog at the salesperson's fingertips in a manner that would allow them to hone in on those questions the customer needs answered so that they can make that buying decision. We've tried electronic brochure representation. We've gone through different ways that customers can use their hands to manipulate our map to learn about network coverage. And we believe that we have finally found the one piece of technology that brings all of that together in a collaborative environment that will help that salesperson really build that trust relationship with the customer. So based on everything that we've learned over the last couple of years from the tools that we've tried, we fell in love with Microsoft Surface and its ability to build a collaborative environment and do some other pretty cool things like communicate with our devices and make our devices jump out of their shell and come to life for our customers. We began our discussions with Microsoft the end of last year, and in a very short period of time, we're able to build an application with help from Avenue A Razorfish that brings our products to life and that really invigorates the sales process and takes the salesperson through the steps that helps our customers really decide that AT&T is the right provider for them. Based on the research that we've seen, it's been a fantastic execution where we've increased traffic in our pilot stores by almost 25%. And we've seen some very, very good returns on customers being able to make that purchase decision, their willingness to recommend that store and that process to their friends and family, and their ability to hone in on the products that they want and feel very comfortable with what AT&T can offer them in the communications realm.
Northeast Georgia Health System is a not-for-profit community health system. It's comprised of 2 campuses in Gainesville and a 3rd campus planned for the greater Braselton area. NGHS is proud to have the #1 cardiology program in the state of Georgia as ranked by Health Grades, and also is in the top 8% of cancer programs in the nation. Our mission at NGHS is improving the health of our community in all that we do. In a manual environment, physicians communicate directly with nursing about when a patient needs to be discharged. Rarely does this information get communicated to the environmental services staff and bed placement who need to clean the room and place new patients in those beds. Another example for this is with imaging studies, such as CT and MR procedures. With these studies, typically patients are taken away from the room for hours at a time. In a manual environment, if other departments, such as lab or respiratory therapy, need to visit the room, they'll waste a trip while the patient's away. And likewise, when family or friends visit the patient, they'll waste a trip and not know where the patient is or when the patient will be back. Northeast Georgia Health System implemented McKesson's Horizon Enterprise Visibility System, HEV, in June after a 6-month implementation process. The system consists of 40-inch flat panel monitors located at each nursing station that show maps of the rooms on each unit. The maps show over 60 room and patient indicators that display things like when blood is available, when meds are available, if a critical result has just become available, or if a patient has certain frailties, such as a fall risk. The HEV system receives interface transactions from over 160 different hospital systems and updates these maps in real time based on these interface transactions. The system is also web-based and is available from any computer throughout the hospital campus and also available from the internet. It's early to be computing returns, but the EVS staff has developed a healthy competition where they eagerly look for rooms that need to be cleaned and clean them quickly. Physicians also no longer have to call nursing units to determine what rooms are available or where patients are. With HEV, care providers know where patients are and what important care has been given in real time.
I'm General Manager, Pilot Crew Scheduling, Delta Airlines Incorporated here in Atlanta, Georgia. Delta Airlines is a commercial passenger airline founded in 1929 as a small regional carrier in Monroe, Louisiana, and in the last 80-plus years has grown into one of the leading worldwide carriers in the world. My job is General Manager of Pilot Crew Scheduling. We are dealing with the day-to-day scheduling of pilots to ensure that we have both qualified and by FAR standards, which are Federal Air Regulation standards, legal pilots on every one of our aircraft that operate to and from those cities that we service every day. When Premier first came to us, what we were looking at for currently was the fact that they were dealing with our in-flight division as far as what we call pure blast calls, which means that they feed all the numbers into their system and all of our flight attendants are called at once to give them information. That could not work for us because we could not contact every one of our pilots at the same time in order to give them the information for flights available. We had to contact each pilot individually, one at a time, and give them the opportunity to respond to pick up that flying prior to us going to the next pilot. So that was where the intricacies of this program came. And Premier just came in and they grasped it. They immediately started, working with us, asking us questions we never thought to ask ourselves because they were the experts in this field. And were really in less than, once we received funding for the project, in less than 90 days we were up and running with a fully tested, working, and accepted product.